Hair transplants, a solution embraced by many, yet shrouded in myths and misconceptions. Today, we separate fact from fiction and debunk the most common hair transplant myths. Get ready to uncover the truth about this transformative procedure. Hair transplant results are immediate. Fiction. There is a recovery process related to hair transplant, so it's not exactly immediate. Initially after surgery, you have small scabs right where the hairs were placed. Then those scabs usually fall off between 10 and 14 days. What you have left after that are the small shafts of hairs that were originally placed. Those shafts will fall out between 2 and 6 weeks post-operatively. Then it takes about 3 months for you to see some fresh regrowth of hair. The hair doesn't all come in immediately, it happens in stages gradually. Month after month, you'll see some improvement in hair growth. Then at about 10 months, you're at maybe 90% of your results, and it can take up to 1.5 years for you to see the final results of your hair transplant. We have a video out there that covers this process in detail and goes over other post-operative recommendations. Make sure to check out that video. Hair transplants always look fake and obvious. Fiction. Performing hair transplants requires an artistic touch and strong technical skills. And it's also very much a team effort. A hair transplant can look natural and undetectable if performed properly. Especially important are how the markings are done, the shape of the hairline, blending the transplanted hair in with the surrounding hair, taking into consideration future hair loss potential, observing the proper direction, angulation of hair, as well as creating irregularity, and using the correct sizes of grafts depending on where you're working on the scalp. Getting a hair transplant is a safe procedure. Fact. Assuming the following are maintained: cleanliness, calculating a safe dose of lidocaine, or if a general anesthetic is used, using that safely, avoiding over-harvesting or over-implantation that could potentially compromise blood supply, and avoiding aggressive hairlines that could be difficult to correct later on. Everyone is a good candidate for hair transplant surgery. Fiction. In determining proper candidacy for a hair transplant, we always want to make sure that the following are true: good general health, limited anticoagulation on board, sufficient donor supply, no active inflammation such as alopecia areata or scarring alopecia, and of course realistic expectations as it pertains to surgical outcomes. Hair transplants are permanent and cannot be reversed. This one is part fact and part fiction. Hair transplants are permanent if at least one of these items is true. Transplanted hair is DHT resistant, which, remember, with FUE surgery, some percentage of the hair that's transplanted will not be DHT resistant. And the other item is anti-androgenic medical therapy is employed. Hair transplants can be challenging to reverse, but they can partially be done in certain circumstances. For example, if a hairline was placed too low with follicular grafting, you can potentially use FUE technique to punch out some of those grafts that are not positioned properly, or if too heavy of a hair was placed right at the hairline. The only problem is that wherever you've punched out those grafts, you'll now have small circular scars. So you need to weigh the pros and cons of leaving that poorly placed hair in place versus the alternative of having small scars there instead. Hair transplants are not the only option for people experiencing hair loss. Fact. Medical therapy can be helpful as a standalone option without a hair transplant or in conjunction with a hair transplant. Examples of medical therapy for hair loss include minoxidil, finasteride, spironolactone, and PRP, to name a few. And we have videos on each of these topics, so make sure to check out those. People can also consider camouflage options, and this can include wigs, scalp micropigmentation, or fibers to give the illusion of increased density. There, of course, is also the option of just going bald or sporting your hair loss with pride. Hair transplants are extremely painful procedures. Fiction. The day of surgery, pain that you might experience comes from the lidocaine injections, and these are usually brief and can be made more comfortable if proper technique is practiced. For example, injecting the lidocaine slowly through a small needle with a small syringe, generally helps. Also, minimizing the overall quantity of lidocaine used is also helpful for reducing pain and for improving overall safety when it comes to lidocaine toxicity. Postoperatively, pain is quite minimal and usually lasts for about 24 hours. Some patients, under 5%, at least in my practice, after FUE surgery in particular, may experience burning or increased nerve sensitivity in the donor area for 1 to 3 weeks. But this does always subside. Only men can have hair transplants. Fiction. In my practice, about 90% of hair transplant patients are men, and this is similar across almost all hair transplant clinics. Women will most commonly get hair transplants for the following types of cases: hairline lowering or sculpting of the hairline, eyebrow hair transplants, and occasionally for frontal scalp density improvement. But given that hair loss in women usually is more diffuse compared to men, you have to be careful with how you strategize a hair transplant for women. You should avoid hair washing after a hair transplant procedure. Fact: careful measures should be employed postoperatively to ensure the safety of your grafts. And you have to be especially careful for the first 72 hours. That's when the grafts are most susceptible to being disturbed and potentially being lost. The day after surgery, we recommend spraying the grafts with the same holding solution that your grafts were bathing in during surgery. Basin washes are permitted and recommended 2 days after surgery. Regular showering can resume at day 6. And again, we have a video on postoperative recovery after hair transplant surgery, so make sure to check that out, as all this information about recovery is covered there. Having a hair transplant harms the donor area. This one is part fact and part fiction. Let's just start with a basic truth. Both FUT and FUE harvesting lead to scarring in the donor area. With FUT, you get a linear scar. With FUE, you get these small dot-like scars that are dispersed. Harms from scars can be minimized with the use of proper technique for each of the methods. You want to avoid over-harvesting with any one surgery. So for example, a single day FUE procedure of over 3,000 grafts can start to run the risk of over-harvesting, and that could lead to more shock loss in the donor area, and also it usually leads to worse scarring in the donor area. The example that I sometimes give is that if you're looking to transplant 5,000 grafts with FUE technique, it's better to split those into 2 separate surgeries of 2,500 grafts each, let's say a year apart, as opposed to doing one surgery of 5,000 grafts at one time on the same day. You can only have a hair transplant on your head. Fiction. Though the head is most common, both your donor and recipient areas can be in places other than the head. The donor is most often the scalp, but the hairs can also sometimes come from the neck, the chest, and sometimes the back, depending on the clinical scenario. Some people also harvest from the arms and the legs, but I find this to be much less reliable. As far as the recipient area, the scalp is again most common, followed by the eyebrows and the beard area. Sometimes the recipient area can be an entirely different part of the body, including the pubic areas, the underarms, the chest, and extremities. Hair transplants are always expensive. Fiction. Prices vary significantly. The range for a single surgery can be anywhere from $1,500 to say $50,000. And this depends on the location of where you have it done in the world, and also on, of course, the specific clinic. Some clinics charge by the graft, and some charge based on the case size, and some use a mixed type of model. While price, of course, matters to most people, make sure to factor in quality and safety as well. You must go under general anesthesia for a hair transplant. Fiction. Most hair transplants are done under local anesthesia. Some may add oral sedation and or IV sedation to keep the patient more comfortable. As you guys know, in my practice, I like to offer Ambien and Valium pills to help ease the procedure for patients, especially in the first part of the day. Some clinics do employ general anesthesia, though this is quite rare. Given the length of some of these hair transplant surgeries, general anesthesia is usually not recommended for these cosmetic elective cases, since many times they're lasting over 6 hours, which is usually the limit of what's recommended by most accreditation bodies for general anesthesia. A hairline part can be altered during hair transplant surgery. Fiction. Almost always a natural hair part is maintained, as this is where the direction of the hair starts to change. The hair has a certain directionality as it exits the skin surface. Implanting hairs in a different direction would actually lead to an unnatural type of appearance. And removing hairs at the part line to then reposition them is something that some patients have asked me to do in the past, but I don't recommend that. And I also give patients a heads up that the area where the natural part line is where the hair will continue to look the thinnest even post-operatively because of that directional split. Your hair transplant surgeon matters. Fact. While the surgeon may not perform every single step of the hair transplant procedure, they are the person ultimately responsible for you, both for your aesthetic result and for keeping you safe. And your surgeon is also the one that selects each team member, and a better surgeon will be able to select the best team possible to do your hair transplant. Your surgeons should also be an artist, as we said previously, so make sure to choose wisely if you want a natural result. Medical insurance will not cover the cost of a hair transplant surgery. Fact. Insurance will almost always deem a hair transplant surgery a cosmetic procedure and will not cover it. Unfortunately, even for burn patients or cancer patients, a hair transplant surgery is rarely covered by insurance companies. I should avoid exercise after a hair transplant. Fact. We recommend avoiding exercise and sweating for the first week. This reduces bleeding and reduces the chance of graft disruption. After 1 week, light exercise may be acceptable. After 2 weeks, most exercise is allowed. And I usually recommend waiting 3 weeks before you resume swimming or sauna type of activities. FUT and FUE hair transplants are the same thing. Fiction. While the implantation process is actually the same, the harvesting and the graft processing is different. FUT involves removing a strip from the back of the scalp and dissecting it under the microscope into individual grafts. FUE involves punching out individual grafts with less work required under the microscope, unless of course we're making single hair grafts, in which case microscope work is important. Each of us has a unique relationship with our hair, and it's intertwined with our self-image and confidence. By debunking these myths today, we hope to empower you with clarity and wisdom. Stay informed and walk confidently in your choices. Thank you for allowing me to be part of your hair journey.